Today we're speaking with Dr. Dan Pompa, an oral surgeon from New York who speaks for Colgate as well as the American Dental Association. Dr. Pompa, thanks for coming today and answering some questions for us about medical emergencies.
Thank you for having me, Suhan.
Dr. Pompa, I had the pleasure of listening to your seminar on update of medical emergencies on the Colgate website, and you opened your presentation with a quote from Mark Twain. Why did you use this particular quote?
Okay, well, thank you. The quote being, it ain't what you don't know that gets you in trouble, it's what you know for sure that does. And the reason I use that quote is because in my research, I found an interesting article that was written in 2014 by Craig Miller. And this was in the October issue of the Journal of the American Dental Association. And in this article, he found that 83% of people that came to our office had abnormal either urinalysis or blood test findings when they were tested, and they did not indicate any type of a disease process in their medical history. So it's sort of like we think we know our patients, but the truth is that they're often strangers when it comes to having medical conditions that we don't know beforehand. 30% of the U.S. population has hypertension and 10% of the U.S. population has diabetes, which of that percent, 50% is undiagnosed that have hypertension and 30% is undiagnosed that have diabetes. So simple tests like a blood pressure, which by the way is required for taking when you use local anesthesia. And this is indicated in our drug insert that simply says on the use of local anesthetic, blood pressure and vital signs should be monitored. In my medical emergency course, I also talk about the use of a glucometer and having a glucometer in the office, which is an inexpensive item. And in patients that are questionable or that have a history of diabetes in their family, taking a blood sugar is such an easy thing to do.
What are the most common emergencies that clinicians in private practice would see?
Okay, the most common problem that is actually talked about in all medical emergency courses that I go to or have attended over the years is syncope. However, on a truly statistical basis, it is really the person who comes into your office that has hypertension that you then go ahead and treat, and for some grace of God, the person gets through it without a complication. So I think the number one emergency is undiagnosed hypertension that comes into your office and leaves your office and you don't know about it. I think that's number one. Number two would then be, of course, syncope, followed by mild allergic reactions, as the top ones that you'd be considering. But in my course, taking a blood pressure on every person because of the drug insert requirement would obviate that as a potential problem.
Now, what would you say are the most important factors in preparing to prevent any of these emergencies?
Okay, by far the number one most important factor is taking vital signs, because that in itself can give you, the combination of vital signs can give you such important clues as to what's going on for the patient. We certainly don't expect people in a private office to take blood tests or urinalysis, but by taking vital signs, you're cued into a lot of potential problems. In addition to that, in my lecture, in my webinar from Colgate, I talk about something called conversational history, which is really very different than your history that you take from that the patient writes down. Because when they write down a history, they really are not there to give you every bit of history that they can, because they think that by giving you all their negative history, you may not want to treat them. So for instance, a very simple question is, how do you drive? And you can ask that patient, how did they get to your office? Because people that are not able to drive because they're uncontrolled diabetics, or because they're uncontrolled epileptics, or they might be alcoholics that have had their license revoked, are not going to tell you that they're not driving there for that reason. But yet you can actually get that information by asking, did they drive there? And if not, look at their medical history and then correlate the two, and you can actually find out something pretty important relative to the controlled nature of their medical condition.
Thank you so much for your time, and we hope that everybody else listening to this interview will listen to the rest of your seminar on the Colgate Network.
Thank you, Soham.